Hello, I'm Judith Davis. Let's think about some of the ways that patients and their families sometimes behave that tend to add to our stress and provoke uncomfortable emotions in us. And think about what we can do to lessen or even eliminate our discomfort. What about hostile patients or relatives? If a patient or relative becomes physically threatening or actually attacks you, of course your first response is to feel anxiety or fear and to take steps to protect yourself and others in the vicinity. You can think about causes for their behavior later. But if a patient or relative is verbally hostile, critical, argumentative, rejecting, belittling, or dismissive of us, we may feel irritated or angry in response. We can remind ourselves that they may be acting that way due to pain or fear. Though they probably don't realize it, their hostility, whatever form it takes, actually adds to their discomfort. But their hostility may have a more complex cause. Is it a long-standing habit? Is it an attempt to deny or drown out their fear? An attempt to control the situation when they, in fact, are not in control? What about inattentive relatives? With relatives who are absent or inattentive, we may have a tendency to react by feeling angry at them, disgusted with them, perhaps even contemptuous of them, and sad for the patient, especially when it's a pediatric patient or a patient who is dying. But why are family members behaving this way? Are they frightened of the situation? Overwhelmed with responsibilities? Beset with such personal difficulties that all they can do is try to take care of themselves? Or just self-centered? What about demanding patients? Patients who are demanding, whiny, or clingy can cause you to feel annoyed. In addition to all the stress you're under, setting limits on them is one more task for you, and that increases your stress, as is trying to extricate yourself from them diplomatically, if in fact you have time for that. Why might a patient be demanding or clingy? As with the hostile patient, it may be a way of blocking out fear. Being demanding may be a long-standing habit that's developed because it's gotten them results in the past. They may be clingy because they're terrified about what might happen to them. I imagine you've found in the past that simply being kind to a patient who is hostile or demanding can often change their behavior. But if it doesn't, what can you do to decrease your stress when you're around them? When you have time, think about one of these patients or relatives and try to understand their behavior. How might it have begun? What purpose is it serving them? Put yourself in their shoes, and even if you can't figure out why they're behaving as they are, your change of perspective will result in a lessening of your uncomfortable reaction to them. As with the previous exercise, if you'd like to, you can share this experience in our Facebook group. It'll help others who are doing the exercise. As for the sadness you feel for a neglected patient, especially a pediatric patient, or for one who's passed away, this feeling of sadness is normal. But if it's intense, it can pervade your thinking, making it harder to function and harder to get the respite and relief that you need between shifts. In addition to lessening your discomfort by changing your perspective on a situation, there's a way to further master these feelings of anxiety, anger, and sadness by using my new technique. I'll be demonstrating it in the webinar and inviting you to do it with me, and I'll be answering your questions. I look forward to seeing you there.